Song titled Medicine there by Timi Dakolo, looking at how those kids are actually really putting joy in the home. Trust me, kids are things of, I mean, they bring joy to the home, and every family would want to have a feel of them. While, bringing them to the world might come with one or two kind of complications, be that as it may, all mothers need to know is to understand some of these complications and how they can deal with them when it sure appears. The tail end of the song looked at it and said, women are actually the king, they're the MVPs, because it's only a king that carries the burden of the world. Now we've been joined this morning by a midwife. I'll be taking us through dealing with some of the pregnancy-related complications, and of course her experiences with dealing with some women that have been there and done that, and how intending mothers can deal with stuff like this when it does show up. She's none other than Benedine Ugulo. She's a nurse and midwife at the Bridge Fertility Clinic. Good morning, ma'am.
Good morning.
Good morning.
And thanks for joining us.
Thank you very much.
It's a sitting of moms, that have been there and done that. I'm going to be sharing our stories in the next 20 minutes. You can be part of the conversation. The number to dial is 090-6000-5100, or use our WhatsApp number as you have on the screen to ask any question. You can also slide into their DM at Bridge Fertility Clinic to ask any questions, and of course book consultations and all if you need to share any personal experience that you don't want to share on air. Now let's come back to you, ma'am. As a midwife, I mean, what have been your one of your experiences you've dealt with, or you've seen, or you've witnessed in your years of being in that field?
Yeah, actually, I have passion with delivery.
Yeah.
Having antenatal care talk, and even visiting them after their childbirth. And actually monitoring them during labor, it has been like a passion. I like to be there, making them at least see that it's a line, a trail for you to achieve your desired blessing. Actually, I had a scenario where I had a medical doctor. She was actually, though she was like a youth service then, not yet practicing, where I worked. So she was in labor. So I noticed that her blood pressure, because during this labor, you need to give a close monitoring of their blood pressure. You monitor the fetal heart, and same time you monitor their dilatation to see how they progress. So I noticed that she was a person that she never had blood pressures during the sale of the antenatal. But all of a sudden, the rise became so obvious. I had to alert the gynecologist on call. Please, you need to come and review this lady. I did a urinalysis test, and I found out she had 3 pluses of protein.
Wow.
She was heading through a pre-eclampsia.
Wow.
So I talked to the doctor. The doctor said, okay, I should just prepare her for emergency cesarean section.
Is that the only option? Because it feels that, yes, whatever things like that
because
come up.
Because this blood pressure was, yes, we need to save the life of the mother.
I'm going to come in now. You said there was no case of this, and she attended antenatal, because for some people they'll tell you said that you didn't start on time, nobody monitored you, but she was good to this, and it only came up at the tail end.
Yes.
And after the whole due diligence in the course of the pregnancy, she's now been faced with a CS.
Yeah, let me comment. She registered late.
Okay. And then
she registered late. Okay. And with this HMO stuff.
How late is late? Let's be sure.
She was above 28 weeks.
When is the right time for you to register for antenatal?
12 weeks. Even 10 weeks is okay. So we have a baseline scan, do an anomaly scan to ensure that you're having a healthy pregnancy. So let me just finish up the story. So after I talked to her, the doctor came in, told her that, see, we need to get this baby out. Because the way your blood pressure is going up, we're afraid you're heading into eclampsia. So she didn't buy it. She was like, well, you need to induce me, medical. I was like, ma, I need to tell you, we need to save you. You need to be alive for further pregnancies. So it wasn't, okay, sure, you have to, okay, fine, shave me. After shaving, we had to okay, let's pass catheter. She said, no, hold on. She changed her mind again. The nurses were like, who is flashing lights? Wow. There was this spark, light visual, blurry visual that was just happening. Just in seconds. Then finding what was happening, this woman started jerking.
Wow.
Wow.
You need to see, the jerking can be so strong that even 3 macho men cannot hold them down to the bed.
Wow.
What was responsible?
Yes, it is now coming with seizures.
Wow.
Wow. Did she give in to it at the end of the day?
She didn't even know. Her husband had to come in. We had to call the husband, please come and sign. We have a stubborn candidate here and we don't want to lose life. So the husband signed. They've actually done the sedated her and other things. Then we had to bring out the baby. Mainly the baby came out with the placenta. What came out from my mouth was, what's going on here? What's going on here? I was like, okay, fine, you are now in heaven. You will see Angel Gabriel soon.
Wow.
So she was not like, oh my God.
Wow.
I was like, congratulations. Yes, you're adorable. She started crying.
At-
That she would have lost.
At how many weeks? I mean, the baby.
She was just 28 plus.
Wow.
So why this? We had to like give a corticosteroid to the woman just to like make the lungs of the baby mature fast.
Oh, okay.
So that he can really.
So that the baby can be able to like face the world with like, the respiration and other things. They won't have respiratory distress when they're out.
That's just one out of many.
Yeah,
Yes.
because I mean, you're just talking about the pre-eclampsia, and then you're saying about 26, 28, weeks for this issue.
Yes.
I had, I was unfortunately I was a patient too, and I had pre-eclampsia. But in my own case, just like you said, there was no history of BP. I've never had BP my entire life or anything. And at 32 weeks, that was when they even diagnosed that, my legs were already swelling and stuff. So first, I would like to first ask the question, like, what are the symptoms that as a patient, as a pregnant woman, what are the symptoms that I have to see to just go like, oh, this is red alert, I have to tell my doctor that I'm feeling this way or feeling that way?
Yeah.
For me to even know.
You not only for you to like see it yourself. When you see you're gaining weight, your legs are now swollen, getting puffy on your face. You now see that your rings and now your fingers are now like getting bigger, getting puffier. So, and when you report this in the clinic, definitely your doctor or your midwife that is attending to you should pick this. Because when you're coming to my clinic, I'll start from your feet to look at you.
Okay.
When you come in, I look at your feet, okay, and I look at your face, and we're not like, oh, you're welcome, how are you? Because definitely, with my expression of you, I mean both your baby and the mom itself. So when I look at it, I was like, okay, you allow them to rest, you offer them bottle, a sterile bottle for urine.
Okay, so
Which is part of their diagnosis when they come in for routine antenatal care.
Oh, really?
Yes.
So you said,
They must do that protein, sugar. We in our bridge clinic, we normally do a 10-parameter test. We detect infection through that urine test, which will now send for further investigations.
Okay.
We pick it, we check your blood pressure, we check your weight, we compare it to the last rhythm to ensure that the weight gain is not so obvious. Because definitely in pregnancy, you're supposed to gain like 12.5 kg. That is if your baby is about 3 kg. So you can imagine those people that are like having babies of 4 points. Definitely you gain more than that 12.5. So when I check your weight and I see that there's really this big markable, I keep you red tag. I ensure you take a lot of water. If you have a protein in your urine, I'll ask, okay, what did you eat? Are you taking enough water? You need to eat healthy during this pregnancy. I advise immediately.
So all
right,
the signs can actually start early.
It starts early.
Okay.
Well, you mentioned that for 10 weeks. I know of someone, if actually close to me, we just had to push her to go register even at 4 months. I don't know, that's really quite late. And you also talked about infections and all of that. For my case, I've been one very strong person. They had to drive me away from work to go and rest because I didn't feel anything. I was very my usual jovial self. And when it was time, it passed the time where the whole delivery date and it didn't happen. There was no bust and all of that. I was in the hospital, the very first, when I started having all of the contractions. All of the women that came to the ward, came, delivered, and I was still there. And the nurses were, they would just call it dilation. Come and be inserting their hands and be looking at the cervix and where it's going to get to. I got irritated at that point. Until the doctor came and now looked and like, okay, this woman is still here. Carry out one or two tests and but it's like a cervix or so, and said that it was small or something that the baby cannot pass through, and they had to, advise for a CS.
Yes, definitely. When you're like monitoring a pregnant woman, when you start up early, a normal scan will be done. Then a later scan will be done. Even you have your OGTT, which is oral glucose tolerance test, to ensure you're not diabetic during the course of that pregnancy. Then there will be this, you visit your gynecologist, comes in, does a ballot test for you to ensure that the baby's head can actually pass through your pelvic bone. Because some women, we have android pelvis. Some have gynecoid pelvis. No matter they have large baby, they pass through. But when you have an android pelvis, when the pelvis is actually closed, the baby can pass through. You don't force the baby through that passage. No matter how long they leave it to go into labor. No matter your dilatation, you might dilate up to 10 cm.
But they were wrong for not to have checked that before. It had to
why
come
is
at
that
the
most
tail end.
hospitals
That's why we have
don't
some
check
people
all
You need
dying
to
unnecessarily.
register in a good hospital that has an obstetrician, a gynecologist.
Not one
But
hospital
again,
attends
most
to
of
everything.
these hospitals, especially private hospitals, they would always invite the experts of a gynecologist
So when
or
you think
obstetrician
of
from-
inviting them,
Yes,
it attracts a cost.
yes.
So they don't want to bear that cost.
So you also want to play around it
So
alone.
you must make sure
And
that
it
that
is
hospital
And
already
detrimental.
has that within-
and you see the medical officers handling it. But even at that, employing an experienced midwife.
But what are these
We'll
school
be
of
able-
thoughts that most doctors or most hospitals want to just, anything that happens, the next thing is yes, without even waiting to push or
Well-
something. But let's listen to Akin from Lagos. Good morning, Akin.
Yeah, good morning once again.
Thanks for joining us.
Yeah, you're talking about the pregnant woman herself.
Yeah.
What role will the husband play in times of pregnancy? Because when my wife was pregnant, she was basically in the hospital because she couldn't eat and it was a serious issue. So what role should the husband play when your wife is pregnant? What symptoms can the husband look out for? Because a woman can be very stubborn.
Yeah.
So what can the man do to help the wife and the baby also?
All right, thank you very much. The midwife will give you answers now.
Okay, thank you, Akin, for calling in. Well, actually, in our facility, what we normally do, we invite the men. Because I ever call them, they say that you're coming in for uncle-natal, not antenatal. I say you're coming in for uncle-natal. So you come in, you hear from us, because we do an audiovisual class. What to expect when the woman is like derailing from the normal track. You can figure it out. You ensure your wife is eating healthy enough, taking a lot of water during this pregnancy.
Okay.
We tell you the signs, what to look out for when you're having issues. So even if, like normally for some early pregnancies, I advise them not to take pineapples.
All right.
Because it
really?
contains, yes, it contains bromelain.
All right, we're going to come back to you. We have Beke on the line because we have to wrap up this in another 5 minutes. Good morning, Beke. Hello, Beke, are you there? Hello, are you there? All right, sorry we kept you waiting. Can do well to call us back.
Why she's saying that, I'd like
Okay.
to ask this question because I know that we're out of time. The issue of miscarriage in during pregnancy. I mean, you have some women. I have witnessed a lady who, once the child is 3, once her pregnancy is 3 months, she has a miscarriage.
drops, yeah.
It just drops.
Yeah.
And I was there when she was complaining to the doctor, but the explanation for me was really Asian.
Yeah.
I didn't understand what they were really saying at that point.
Actually,
in time. So
during this early pregnancy, we advise them not to take pineapples, not to take pawpaw.
Okay.
Because the pineapple is to break down the protein, and the pawpaw tends to cause contractions.
So
in
pineapple
the-
is not good for
Yes,
pregnant
it's not
women.
good for pregnant
I'm hearing that
women.
for the first time. I
Yes,
was thinking
please.
it too.
Because
That's
it causes
my best fruit.
miscarriage. And apart from it, so if you're having those kind of frequent miscarriage at 3 months, what you need to do, have a circlage that tie the mouth of the womb, and you normally have to be in strict bed rest.
So I'm hearing
So
it
that
for the
to
first
allow
time.
the baby to
Pineapple,
stay.
pawpaw, dangerous for pregnant women.
Yes, early pregnancy. You don't need to take it. It breaks down.
So at what point can I start to take, especially if I have cravings for it?
From 38 weeks, you know that definitely the baby is now held enough to come out.
Okay, so it can still aid the contraction.
So
and
it can
what-
even help the contractions and other things. So
All right, let's take Beke is back on the line, the last caller for the segment. Good morning, Beke.
Yes, good morning to you all.
Good morning.
good morning.
Yes, the area a man can help the husband, the wife, just as the man that asked the question, is to help the woman most of the times, make sure she take her routine drugs.
Yeah.
because some of them, you give them the routine drugs, they'll keep it there and say it doesn't matter.
I used to throw it under the bed.
And then the early stage of the pregnancy, you have to help the woman to make sure she gets registered in a very good place, good hospital if possible.
Yeah.
Because a lot of women, they will wait until they get up to 5 months, 4 months before they will start talking of registration. And when you give them drugs, they will just drop it somewhere, and then every day they are complaining.
All right.
Because when you go through the antenatal all the time, it will give room for the doctor to really know if there's any time of complication for them to know how to take care of it.
Dr. Beke, thank you.
Then finally, the woman.
Oh, okay. Thank you very much. Okay,
also,
that's why.
so
Yeah,
yes,
thank you. But before you go, we put it side by side. We also have some infection. I remember I also had some stuff. I mean, stuff coming up from the uterus. Some very crazy.
Why do we even have
and
infection
then
every
two
time
to one, people have been calling to say that it seems that CS is on the rise.
Yeah.
Whatever happens before any doctor says anything,
CS,
go in for
they'll just tell
cesarean
you
session
budget 350,
because they feel
250.
they're using that to make money. Or at what point should that be the last resort?
Yes, CS should actually be the last resort. Definitely when you feel that you will actually be monitored. And when you listen to the fetal heart, and you see the fetal heart of the baby is now going up more than 160, entering 180, definitely there's a distress. You need to get that baby out. Or the woman wouldn't like to have a dead baby through the vagina. You want your baby alive. So you need to opt for a CS. And normally when you see a diabetic mother, definitely the baby is going to be very big, macrosomic. You don't need to go through vaginal delivery. And at the end of the day, you end up at a baby bed where they are trying to reset your hips and other things. No.
Okay.
And at times when you force the baby through the birth canal, and when you know that baby is actually big,
It can affect the mom.
it affects the baby.
Oh, the baby, yeah.
Yes.
Okay.
Oh, really?
Okay. All right, we need to go now. What's your advice out there for expectant mothers and those that are in pregnancy now? And of course, what Bridge Clinic does?
Yes.
You have all this in 1 minute.
At Bridge Clinic, especially the Medi Center, we have a very loving doctor. We have the midwife, my humble self, and my nurse too. So we'll do a back-to-back. Ensure you go through a process, a smooth process, till the time when you're having your baby. And both baby and mother will be alive. That is what we ever dreamed of, having both mother and baby alive. So what I expect them to do, register early. Ensure you do your urine test. Ask for a urine test to be done at every visit. When you're having urinary symptoms, you pee and it's painful, please report to your doctor. When you're having this smelly discharge that is fishy, please report to your doctor. Always ask, what is your urine test? What is your blood pressure? At every visit, what is your weight gain?
Okay. All right. Thank you
At
very
every
much.
visit.
Thank you very much, Nurse Benedine, of course, a midwife at the Bridge Fertility Clinic, and we wish all mothers there that bundle of joy, of course, will be delivered to you safe and sound. Just go through some of these complications are normal and avoidable, and you can track, the progress and do the needful. Just adhere strictly, and like he said, stay away from some of these fruits and always see your doctor. No self-medication. And of course, we'll see you some other time because I wanted to look at how some religious beliefs. Some people tell you
give birth like a Hebrew woman.
A Hebrew woman, that's always an issue. But
that's another
until next time, thank you very much for coming. We'll be taking a break at this point. When we come back, it's also Sickle Cell Awareness Month. I'll be having a patient and, of course, an advocate here talk to us about sickle cell. Stay tuned.